Breast cancer begins with the development of a tumor within the breast. Some cells within the breast may undergo changes in their cellular structure that cause them to multiply rapidly. This process is known as hyperplasia. As hyperplasia persists, a tumor will form. If the tumor is benign, then it can easily be removed without any major risks involved. However, if the tumor is malignant, then it becomes much more dangerous and may involve a mastectomy or removal of the entire breast. Breast cancer is the second leading cause of cancer death among women. There are many risk factors involved in the development of breast cancer, including age, reproductive history, and family history. Although the knowledge of these risk factors is helpful, the best way to prevent breast cancer is through early detection of the disease. This can be accomplished with routine breast exams and with mammography. Tumors, like the one shown in the mammogram on the right, can be detected early in their development. Circumcision is the removal of the foreskin or prepuce of the penis. A circumcision is generally performed for hygienic purposes because the glans penis is easier to clean if it is exposed. The first of two incisions is made vertically across the prepuce. The second incision is made with the help of special surgical tools. This incision is located around the base of the prepuce. Now the prepuce is removed, exposing the glans penis. In the normal female reproductive tract, the ovary releases ova into the uterine tube, the passageway which carries them to the uterus. The uterine tube is a common site of fertilization of the ovum. Tubal ligation is a surgical contraceptive procedure whereby the uterine tubes are permanently divided. This division creates a barrier between sperm and ova that prevents fertilization. In the normal male reproductive tract, mature sperm are stored in the epididymides. They travel through the vas deferens into the urethra and exit the penis during ejaculation. Vasectomy is a surgical contraceptive procedure whereby the vas deferens are permanently divided, preventing the spermatozoa from leaving the epididymis. Following vasectomy, a man can only ejaculate seminal fluids that are free of sperm cells. Some parents can be concerned about the genetic condition of the developing fetus inside the mother's body. Amniocentesis is a procedure that is used to test fetal cells for any genetic abnormalities. This procedure is normally done between the 14th and 16th week of development because fetal cells are present in the fluid at this time. In amniocentesis, a hollow needle is passed through the abdominal and uterine walls with the help of ultrasonography. A small amount of amniotic fluid is extracted from within the uterus. Within this fluid are the fetal cells, which contain genetic material that can be cultured and tested for chromosomal defects and certain single-gene abnormalities. The penis is filled with vascular erectile tissues that allow it to exist in a flaccid or erect state. An erection is achieved through regulation of blood pressure within the penis. Upon psychic or tactile sexual stimulation, venous blood flow out of the penis decreases, while arterial flow into the erectile tissues increases. The size of the erectile tissues is limited by a dense covering called the tunica albuginea. Engorgement of these tissues with blood results in a stiffening of the penis. Each month, the uterus undergoes a menstrual phase if pregnancy fails to occur. During the menstrual phase, the endometrium is shed along with bleeding that occurs due to the rupture of the endometrial blood vessels. The proliferative phase lasts for about 9 days. It is during this phase that the endometrium thickens. The secretory phase follows ovulation, and it is during this phase that the glands of the uterus make glycoproteins that serve as embryonic nutrition prior to implantation. The secretory phase is approximately 13 days long. The ovary is the site of the development of the oocyte. Within the ovaries, follicles develop. Each follicle houses an oocyte, which matures simultaneously with the follicle. The primary follicle houses an oocyte encapsulated by a coating called the zona pellucida. It also contains a layer of granulosa cells that surrounds the oocyte. The secondary follicle contains many more granulosa cells and an accumulation of follicular fluid that is secreted by granulosa cells. This fluid coalesces in the follicle to form the antrum. A mature follicle is much larger than a secondary follicle, and the antrum occupies a greater portion of the follicle. It is within the mature follicle that the first meiotic division of the oocyte is completed, to produce a secondary oocyte and the first polar body. The secondary oocyte receives most of the cytoplasm from the cell division. However, the nuclei and the chromosomes are divided equally. The polar body degenerates. The mature follicle ruptures at ovulation to release the secondary oocyte and a corona of granulosa cells into the uterine tube. The second meiotic division cannot be completed unless the secondary oocyte unites with a sperm cell. As a result of this division, a second polar body is formed, and the oocyte and sperm nuclei combine to form a zygote. Under the regulation of the pituitary hormones, luteinizing hormone, LH, and follicle-stimulating hormone, FSH, follicles develop within the ovary. Primordial, primary, and secondary follicles contain an oocyte that is suspended in prophase of the first meiotic division. Growth in these follicles is due to an increase in the number of granulosa cells. Secondary follicles develop an antrum that contains the secretions of the granulosa cells. Within the mature follicle, the first meiotic division is completed. A sharp increase in the LH level stimulates ovulation. After ovulation, the remaining granulosa cells and surrounding cells form a corpus luteum. If pregnancy occurs, the corpus luteum is maintained. If pregnancy does not occur, the corpus luteum slowly degenerates to form a corpus albicans. The testis is organized into a network of seminiferous tubules. Within these tubules, spermatogenesis occurs. Spermatogenesis is the production of mature haploid sperm cells through meiotic cell division. A spermatogonium deep in the epithelium of the seminiferous tubules gives rise to a primary spermatocyte. This cell contains 46 chromosomes. A primary spermatocyte undergoes the first meiotic division, producing 2 identical secondary spermatocytes. Each secondary spermatocyte contains 23 chromosomes. The secondary spermatocytes complete meiosis, giving rise to haploid spermatids. Each spermatid contains 23 chromosomes. The spermatids then develop into mature sperm. This is a histological image of the epididymis. The pseudostratified columnar cells bear cilia which are non-motile and are difficult to identify in this image. This is an example of a mammary gland taken from a mature breast. Note the active secretion of the epithelial cells. This is a high magnification histological image of an ovarian tissue section. Note the morphological features of the developing follicles. This is a histological image of an ovary tissue section. This is a photomicrograph of seminiferous tubules cut in cross-section. Between the seminiferous tubules, one can see groups of interstitial cells. This is a histological image of a testis tissue section showing seminiferous tubules in cross-section. This is a histological image of a uterine tube cross-section.